we call upon the next speaker, Dr. Jebit Brayon, to speak on sitting PhacoEmulsification of cataract and intraocular lens implantation. Before he starts, we would be also following with the semi-final session. So those of them who have been qualified in the cataract session 1, 2 and 3, either you call the people or you be present here. So we'll be just following it up. We just have the name list also in case Dr. Deepak Megor in cataract session 1, Dr. Debasis Datta in cataract session 2, Dr. Akash Jain in cataract session 3. Are all of you there? All the other 3? Yeah. All the 3? Yeah, fine.
Session 4 will be announced after this.
After this. And also a final call for the one which is not turned up. Is Dr. Hemant not there? He's not there. Okay. Carry on.
Good evening. The journey of cataract surgery, commencing from the ancient method of couching. Sorry, the slide is not moving. The journey of cataract surgery, commencing from the ancient method of couching, has seen colossal metamorphosis heading to the present day femto-laser assisted cataract surgery. Despite the constant revolutionizing innovations in this field, PhacoEmulsification, introduced in 1967 by Dr. Charles Kelvin, has stood the test of time and prevails as a proud torchbearer for the current day cataract surgery in delivering near pristine outcomes. Traditionally, these surgeries were carried out with the patient lying down and the surgeon operating through an overhead microscope. But what if we encounter these curveballs that hampers the ideal position for surgery? Literature exploration shelled out the following face-to-face approaches to tackle the situation, that is PhacoEmulsification done using slit lamp, PhacoEmulsification done in a semi-recumbent position, and PhacoEmulsification done in a motorized wheelchair. But the catch here, we operate in a secondary eye care facility that caters predominantly rural India, thus depriving us the luxury of sophisticated recliners or a wheelchair. The contemplating under the apple tree, we hit our eureka moment with the PhacoSit, a novel, innovative 90-degree sitting PhacoEmulsification technique that precludes the requirement of sophisticated recliners or techniques. With that, the patient is made to sit comfortably in a wheelchair or a waiting chair, and the head rested on the drape pasted to the walls of the OR. The microscope is rotated at an angle of 70 to 80 degrees from the vertical plane. A routine PhacoEmulsification is carried out with the direct chop technique, the clear corneal incision at 4 o'clock and a paracinder at 7 o'clock. No adjustment with respect to the phaco parameters, the bottle height was required. A coaxial IA was done and a foldable IOL was placed inside the bag. Throughout the course of surgery, the patient's vitals were monitored with sphygmomanometer and pulse oximeter. Presenting you a study, special study, that is sitting PhacoEmulsification of cataract and intraocular lens implantation. The aim of the study is to assess the outcome and determine the efficacy of PhacoEmulsification in sitting position. It is a prospective study carried out over a period of 6 months in a secondary eye care center in a subset of population who couldn't lie down due to supine position. Following a thorough history and assessment of both the ocular and systemic status, the eligible candidates were identified for the PhacoSit technique after proper informed consent. 50% of the patients were denied surgery at 2 other institutions because of the inability to lie down flat. 27 eyes of the selected candidates are operated with PhacoSit technique. The following flowchart outlines the measures undertaken at various steps of the study. Coming to the result, 27 eyes of that 15 males and 12 females were included in the study, and the majority of the eyes were left eye, and the mean age was 58 years. Coming to the results of systemic status, all through the course of surgery, the patient maintained a stable vital status. And coming to the results of visual outcome, we can see, compared with the preoperative visual acuity, there has been a significant improvement in the uncorrected visual acuity and the best corrected visual acuity from postoperative day 1 that has been maintained till postoperative day 90. 88% of the patient has the best corrected visual acuity of 6/6 at the final post-op visit. The time duration of the mean time is 10.37 minutes, and the mean average CD was 12.22. The average surgical duration of the left eye was less compared to that of the right eye, and the right eye surgery has a high CDE values. There were nil intraoperative and postoperative complications. The 21 eyes included in this study, despite we operated on different gates of cataract. The verbal testimonial of patients operated with this technique skewed towards positive response with respect to the level of comfort. The surgeon has to operate with the outstretched hand without elbow support, so that prolonged surgery surgical duration will be taxing. Right hand surgeon being a right hand operating on a right hand, there will be a hindrance because of the nasal bridge for the ease of the mobility. The PhacoSit is a crucial tool for the patient who are not an ideal candidate for conventional PhacoEmulsification. What makes it special, distinctive and exceptional is that it can be adapted by any experienced surgeon operating anywhere without the need of additional resources. Thank you.
Was there any, other than the stretched out hand, was there any other differences noted in a PhacoSit as compared to a routine phaco?
So only the positioning for the surgeon to be, we have to operate the outstretched hand, so that the surgeon is taking a long time, it will be like a little difficult. Otherwise, we didn't find any difficulty in operating this.
Meaning to say the patient is sitting, is there any more of outflow of this fluidics and any fluidic changes?
No, sir, we haven't done any. Regarding the parameters, I haven't made any change. And even at the flow, like, you know, it's a self-sealing wound, like, and
these are all temporal tunnels?
No, sir, in the left eye, we have to put the main incision at the inferior temporal side, and in the right eye, we'll put the incision at the inferior nasal side.
In the inferior nasal, in the?
Inferior nasal in the right eye, when you're operating on the right eye.
Inferior nasal.
Inferior nasal, the nasal bridge is affected, right?
Yes, sir, but it will there will be a mild hindrance compared to, even in the study I have mentioned that the right eye surgery took little more time than compared to that of the left eye.
See, most of the cases of kyphosis can be managed if you put a stool or something there. It's not required to make it sit up, like make it sit position like this. So even the severe most kyphosis can be managed easily. Only thing you have to put a proper pillow, and you can use a stool even, just to raise your legs and do.
Yes, sir. But there were patients even with has respiratory problems who are not able to lie down there, and the patients mainly with this. I have recently saw one patient did one patient surgery with the Meniere's disease. So he has been denied. He's not taken up for surgery in different places, and she's not getting up from the bed when he is about to lie down and put the drape.
And this PhacoSit is being presented, I think, for the last 3-4 conferences.
No, sir. Last 2 conferences I applied for it, but last year and last 2 years I couldn't come and present.
Somebody else had presented.
No, sir. No, sir.
I'll just. We have seen the videos. Yes.
Sir, that is there's a surgical technique of PhacoSit I have presented, sir. This study this study was concluded as a special study. The series of 27 patients. This is a study was present. I'm presenting this for the first time.
Okay.